You heard that? Anyone have plantar fasciitis? Yeah. Yeah, bottom of your feet with too much pressure, too much walking. A lot of athletes or a lot of walkers, they have plantar fasciitis. A lot of times you don't need to see foot specialists. You can just do by doing massage or frozen bottle. You can do massage, or you use some kind of massage tool. You can do soft massaging. So even you see foot doctor, they might, if it's just mild issues, they cannot do much. As I mentioned earlier, just cold bottom massage or golf ball, you can roll.
Is that because of the muscle?
Oh, the underneath your foot, not much cushion there. Only ligament and thin muscle group. So if you put too much pressure all day, it's going to irritate the tendon there in the bottom and some muscle. So make sure you wear soft whole bottom massage shoes or golf to prevent that. You can roll.
Is that because of the muscle?
Oh, that's very common area of our underneath your body malfunctioning. And rotator cuff syndrome. Is anyone using too much shoulder movement with the same repetition, same direction? Anyone doing that? Oh, what kind of work do you do, sir? Oh, so you use a lot of, yeah. So our shoulder has four or five major muscle groups. If you look at here, the spinous process here and rotate the shoulder spinous process. Anyone using the muscle shoulder movement upper spinous repetition, same direction process called supraspinatus controls this movement. Oh, what kind of work do you do, here? Sir? And infraspinatus, so situated a lot of underneath. Yeah, our shoulder has it's called infraspinatus controls 4 or 5 the external rotation. If you look at here, the spinous process here. If you look at this here, the shoulder wing bone spinous process inside the muscle upper spinatus controls process called supraspinatus controls the. So movement. If your job or your sports or your activity do same motion every time, you're gonna strain or sprain the soft tissue. So same repetition always can cause issues with the shoulder muscle or tendon. So you need to take some break if you keep doing same motion. So this motion can cause a lot of damage here, your shoulder area here, upper area. Also, some people do a lot of this one, causing damage here, lower. So this motion, or this one can cause the rotator cuff muscle. So you need to move your shoulder. Maybe you can rotate. Yeah, that's the rotator cuff issue. Yes, sir. Oh, yeah. Your question? Yeah. Which one? Which bone? Which bone? Oh, okay. Oh, that one. As I show you, the cranial nerve controls all the nerves here, your facial. So it might cause or refer to your brain. You might have a headache or some other. Oh, that one, it's not, the bone itself doesn't connect it,
separate.
but nerve, it might refer, the pain refer to the brain. So it
it's
can
the
cause,
Okay. Thank you.
and then we can go to the, some numbers. Where's the numbers? Next one, please. This is a very important subject for your desk, your especially lower back. Have you ever seen this picture? No? Okay. Any students learning medical specialty, this is the basic components for your lower spine, spinal disc. Even you lay down, you have a very minor pressure because of gravity. You have a 25 laying down position, but as soon as you stand, you're going to have 100 pressure, 100 unit to the disc. So 5 times pressure already. Yeah. But if you bend down this 150, that time can cause damage to your disc like this. But if you, with a bending position, if you lift something, heavy stuff, it's over 220. So already 10 times more. So, but if you twist with a bending position, no, if you twist over 300. So that's for your standing position. But if you are sitting, you lift something, another 50 extra, and rotate and bending, maybe 350 more. That's the worst. So this is the proper sitting and standing while you're doing daily activities. So we can go over. Next slide, so I can show you what's the best proper positioning. So we need to maintain this posture, lordotic, always. So I can, if I can have a demonstrator, I can show you what's the proper lifting position for your daily activities. Okay. Okay. So I drop something here, and you need to maintain these two curves, neck and back. So how you can pick up this one without reverse curve?
Without reversing it?
Yes. Oh no, you already bend. So if she bends like this, another 5 or 10 times more pressure to the disc.
Okay, so how am I supposed to do this?
So okay, here.
I'm gonna ask for something that don't work, right?
Okay, yeah. Just maintain this curve here
Okay.
and bend your knee with the same positioning. And then lift.
Okay.
Or when you lift something,
If you got bad knees, you're in trouble.
no rotation, no rotation, but you can just change your direction and then this way. Okay. Yeah, please. Now you can do. Yeah. Yeah, very good. One. Plus.
Okay. I
Yeah,
have never.
thank you.
I have never. Okay.
But when you do, instead of two legs next to each other, I just usually go like this. So at least you can spread out the weight. So go like this, better. Instead of doing this, more pressure. Yeah, that's the basic lifting. No, we need to maintain the curve. Very simple. We have two curve here, two C curve. We need to maintain. So if you minimize bending, you can have your disc healthy for a long time. But if you give a lot of pressure with reversed positioning, more susceptible to the damage. So I'm talking about the disc injury. So we need to maintain. Yeah. Oh, question. Yes, ma'am.
So we do the golf pickup that you use like on something and you don't bend, but you just lift. You don't bend down with my bad knees, but you lift with your leg going straight down. What do you think of that?
Golfing?
Yeah.
Or golf ball?
Yeah, like the golfers do.
Oh,
They
still
hold the club.
some damage. Some damage.
Some damage.
Yeah. So when you do golfing, swimming, volleyball, most of sports athletes, they have to use muscles. In order for you to get strong muscle reaction, it has to you have to shrink. Yeah. Yes. Shorten your muscle to have a maximum function. So golfing like this, they cannot do this. It has to be this way. Or swimming, same thing. Baseball, same thing. Everything, all the muscle has to be together. But it's not good for posture.
Okay, so what we're saying is to use something to anchor your hand on, so that when you bend over, you can have that leg come up and you keep your back straight as you go down.
But this one better, instead of this one. Right. So yeah, if you have bad knee, minimize or maximize to keep the same curvature. Just a little bit alteration is okay, but not too much. You're going to give damage to the disc. Yeah, minimize is better. Yes.
With the lower back injury and walking, and you can't walk straight because of and you have that curved walk, how do you work with that, with the lower back injury?
Oh, you need to do proper stretching, which I will show you, and some strengthening with some other muscle, stabilize your back. So I'm gonna go over to some muscle stabilization exercise for your lower back and stretching exercise for your back core muscle. There are a few core muscles in our body, anterior and posterior, and here too. Core means center. Yeah, core means heart. Heart from Roman period. Heart, very important area. So core here, 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 here. Yeah. And no picture? Okay. You can, the first picture, she's sitting, yeah, she has a bad posture with the extra kyphosis and bending. And next one, she sit properly with curves. And then third one, she has a sit cushion, lift her hips. So less pressure to the lower back, but some weight goes toward the knee. So you can order that one through Amazon with the angle cushion, at least 10 degrees. Have you ever seen this cushion? No? Yeah, you can use that one. So you lift your hip, maintain, and yeah, you'll see this one here. Also, foam roll. That's for your back spine stretching exercise. Have you ever seen this foam roll? Yes? Yeah, you can order through Amazon. You can place that foam roll here, mid-back, on the floor. You can stretch maybe 5 minutes, and then you can move your arm this way, from lying down, this way, and this way. So you can stretch your shoulder or back muscles, and also pec. Do a lot of this one. I'll show you what kind of, yes sir? Oh yeah, you can do that. And can we go to next slide?
Question here.
Yes?
I was just going to say, I drive with that first cushion that has the slight
Angle? Oh yeah, I use that too. Yeah, I use that too. You can use it for cushion, or when you're driving, or when you're at home watching TV, you can have that cushion. It works pretty good. Yeah, sit, or you can put your back and relax. It gives you a lot of support, but maintaining the curve here. Yeah, it's about $12. Okay, yeah, just like that one. Chair or while you're driving, the cushion. And the other one, just for stretching your back, the first picture. Yeah, you need to. No, that's a angle cushion. Cushion you can do for your hip, or while you are sitting, you can put it in the back. Oh, the left one. Yeah, you can order through Amazon. Yes. And then next one, can you go next one? Okay, this one, you can practice by doing wall exercise or stretching for ideal posture for standing, sitting. Have you ever seen this? YouTube? Oh yeah, yeah. YouTube shows this one. That's very basic. Any volunteer? So I can show you to everyone. Okay. Here. Let me see. Where is the wall? Can you see us? Oh, okay. Okay. Right here. You stand against the wall, and you push your lower back toward the wall. Can you push?
Push it toward the wall?
Yeah.
Am I doing it right?
Yeah.
Okay.
With the belly. Yeah.
Okay.
Push. Okay. And then next one, shoulder.
Okay.
You push against the wall.
Okay.
The next one is shoulder. Both sides. And then bring your chin down. Press here toward the wall. Oh, bring chin down. And then can you push my hand? Yeah, and here same time. So your ear line, shoulder, hip line should be in same plane. How you feel?
All right.
Yeah, so standing and sitting, you should maintain this way all the time.
Oh, really?
Yeah, all the time. So you can walk with the same positioning. Can you? Oh, no. Oh, here. Okay. Okay, here. Open your chest, and then you can. Yeah, pretty good. Any other person who want to practice? Please. Oh, you want to practice this? No? Oh,
There she is.
oh, can I show you one more time? Okay, yeah.
How far are the feet away from the?
Feet about this much is okay. It doesn't have to be all the way in. Yeah, the feet is not that important, but the back close to the wall is important. Oh, here, can you push? Yeah. So you should feel something.
Oh, I do.
Yeah. Your abdomen and
Your back, the small of your back against the wall.
against the wall. Okay, can you
should get
feel?
up and try it. It's a
Yeah.
little awkward.
Yeah, right here, right?
Uh-huh.
And then next one. Okay. Yeah.
Okay, push that in.
Yeah, push in.
Okay.
And then let me show you just real quick here. Here, sir. Can you push?
Push it.
Yeah, push your belly.
Yeah.
Should be in.
Against the wall.
Against the wall. And next one, shoulder. Can you push? Yeah.
Oh.
Then here.
Okay.
Can you push? Yeah. Yeah, better. Better. Push, yeah. And then shoulder, next one. Oh no, same time. And then push.
Yeah.
And then shoulder.
That's hard.
And then third one is your neck.
Okay.
Bring your chin down and then push.
Push back.
Yeah, push back. Same time shoulder
Okay.
and then back, same time.
Oh.
So this one called anterior pelvic tilt. You push in to the wall, pelvic tilt, shoulder touch the wall, and then chin down, push back. So those three main components. Yeah, and then natural, and then you can go back, maintain, yeah. Looks good. Looks good. Okay, here.
This is nothing like
Yeah,
a wall.
go ahead. Yes, sir. Oh, feet doesn't matter. Whatever comfortable. Right here. And she has a shoulder position about this much forward for her daily activities. So if she gets older, more. In 30 years, she get more.
That's why I lean
Yeah.
so much at work.
Oh, here? Yeah.
Yeah.
Everyone gets leaning more later and then become more hunchback. Later, it's hard to reverse it. Oh, here? Yeah. Here, push. And then shoulder, more. And then chin down, push back. Yeah, this is ideal posture. So when you walk, sit, same thing, maintain, yeah. Here, same thing, push, here, yeah, push, oh, here, wall, to the wall.
Can't.
Yeah.
It's hard to push.
Oh, okay, practice. Oh, no. Oh, can you push back? Oh, yeah, better. Oh, yeah, this is the feeling.
Okay.
Yeah,
Right.
you have feeling. Yeah,
Oh,
that's
right
it,
there.
that's it.
Oh, okay, got it.
Now you know.
And then.
And then shoulder and neck. Yeah,
Oh.
push. Okay. But here, you know the feeling, right? You know the feeling, your back. Maintain. Now she knows pelvic tilt. Yes, sir. This way. Now you have better feeling. Yeah. Oh, you need to do this practice at least once a day, so you can remember what's the proper posture for yourself. Yeah, and sitting too. More you do computer work like this, more military neck and reverse, then more burden here, more pressure. Also, the bony shape will be changed.
But that's supposed to straighten us out, right?
Yeah, straight.
But I thought we were supposed to have two curves.
Yeah, but it still have a curve. It never become straight. Yeah, so keep practicing. Because a lot of people, they are forgetting. But if you look at in the back to other person's posture, now you know. You can see. But before, nobody pay attention. Now you know more about the posture. Yeah? Yeah. Yes. Let's see here. So improve the posture. I show you all the demonstration. Can you go down? No, can you go next one? Oh, here, from table, you can do shoulder stretching like this, and you can make a circle, 360. Then that way you can open up your chest and make it straighter for your back. You can do at least 1 or 2 a day. That's a very common one for posture. Yeah, from lying down. Yeah, with table better, with a table. I show you the proper standing practice. Also, the last one I did mention about good pillow. There are some pillows in Costco, but Tempur-Pedic has the best ideal posture. Tempur-Pedic, standard size, not too big, but standard. Small, standard, has a shape to maintain the curve here. Yeah, you can order through Amazon. Sometimes they have them on sale. 2 for 1. Yeah, Tempur-Pedic. Tempur-Pedic. So you need to maintain this shape, not too thick. Yeah, what kind of pillow size do you have at home? Extra large, it's this thick, then it just it might change your neck curvature. Yeah, so it's supposed to be this way, but if you have a higher one, it goes like this, then reverse curve. Yes, sir. Yeah, so you should change more thinner and just covering this section here, not here, but more here. Yeah, you can place your head this way. Yeah, sporting here, not here. Yeah. Oh. I recommend Form 1. Farmer. Yeah. Moves. Oh. But there's no advantage, I think. Yeah, flat and firmer, but not soft. Yeah, that's my recommendation. Tempur-Pedic. Oh yeah, that's it. Yeah, but sometimes they have a copy in some market, but if you get original one, better. Which area?
Right in the side, is it nerves or?
Yeah, it might be gland.
I should get checked by a doctor.
Yeah, and medical doctor. MD. MD, you're a primary care. Yeah. Can we go to next slide? Okay.
The pews here that I sit in the back there, because I know my feet don't touch the shore, but I sit completely back. Sometimes I'm like this, and sometimes my leg get dead.
Oh.
I don't know what to do back.
If you have some back cushion, it's better. Back cushion. Or yeah. Yeah, don't bend this way for your back. Because more pressure. We need to. Oh yeah, you can move around. It's okay. Oh, you mean the sideline? Yeah. It's okay. Sideline, it's okay. What was that? Oh, yes, just sleep on the back or side with some kind of cushion between legs. That's the best one. Yes, with some cushions, better. Yeah. Yes?
I slept on the same side for about 20 years, and now that leg is shorter. Is there any way to get it more lengthened?
Oh, you need to change your positioning, but not same positioning all the time. Change. Yeah.
Well, I'm no longer doing that, so I
Oh.
just want to really go back.
Yeah, just try other side too. So you see how it works. Yes, sir. Oh yeah, yeah,
That's it?
yeah. But this has two.
You don't need to.
No, we need two.
You do need to?
Yeah, not this one. This one. But small size,
Where
standard.
Where did your head go?
Oh, the
Hanging up.
thicker one.
Hanging over the top.
Oh, on the neck. Thicker one. So he will show you the proper one. Yeah. Can you go next one? Okay, next one. Next one. Next one. Okay, as I mentioned earlier, attention please. On your foot, usually there are many muscle group or thick muscle, most of them bones. So a lot of ligament, two bones connecting, tissue called ligament. So with a lot of pressure, can damage on your bottom of your soft tissue. So make sure you have a soft shoes, not high heel. Sometimes when you're coming to church, high heel, but most time with sneakers. That's the best one. No, what do you call? Tennis shoes. Yes, tennis shoes. Yeah, tennis shoes. So a lot of times with pressure, you're going to have a lot of tension in the Achilles tendon area. So do a lot of stretching by raising this top of the foot that way. So you do a lot of stretching for your gastrocnemius muscle in the back or tendon in the Achilles area. So those two need to stretch very often. Yeah, a lot of ligament. So I see some people from jumping. I saw some fractures into bone, so be careful. Not just the landing from a table. Yeah, damage. Be careful. Next one, sir. Next one. Oh, this is very important for people at age 60, 70, 80. If you stretch, the muscle will be longer. If you make it tight, shorten the muscle. So you need to sometimes stretch. But if you resist, you push, do a lot of strengthening exercise, make it stronger and more muscle mass. But if you just left it alone, without doing anything, stay in bed long time, you lose muscle mass. So muscle function, you need to be more active with the resistance. So with a small dumbbell or push-up or short walk, you have to use muscle. So every year from age 60, we're losing 1%. 1%. If you do proper activities, still maybe 1% or less. But if you do more active, maybe you're losing less. Yes, sir.
So is that to say that all of this activity and exercise, maintaining our muscle structure, supports the spinal column? They kind of work together?
Work together. I'm talking about the muscle, losing muscle in general, maybe 0.5% or 1%. It depends on how you manage your daily activities. But when you mention about the core muscle supporting the spine, there are a few muscle groups we need to strengthen, which we will show you in next slide. Please. Yeah, this is what I was talking about, sarcopenia. Yeah, reduced physical activities and malnutrition. And also, when you get older, protein synthesis, reduced. And less protein intake and less exercise can cause sarcopenia. So 1% loss. So we need to maintain same muscle mass for our future health. That's what shows. Can we go to the next one? The gentleman just mentioned about the core muscle for your spine. This is for neck area. There are main muscle group here. It's called colli, longest colli, supporting the front area of your spine. And here, next to longest colli, there is a scalene muscle. When you move, this muscle here, that's the main core muscle for the front of your neck. Can you go to other slide? And one of them, when you turn your head, there is a, can you turn and touch your, there's the main muscle, that one. That's called SCM. That's for supporting your head, and when you turn, you're using this muscle. So in order for you to strengthen and maintain good components, you always do stretching. Or you can do three things. First one called active range of motion. You can just do this, active range of motion. And then assisted range of motion, you can just pull, and different directions. That's the assisted range of motion. And third one called resisted range of motion, with the resistance. So that strengthen. So I show you the exercise sheet. I show you the paper. That's the active assisted resistance exercise for neck and back.
Do you recommend taking protein supplements,
Yeah, so protein supplement.
a lot of proteins?
Oh yeah, it helps. Can you go to next one? So if you look at here, there is a disk space reduced. As you see here, supposed to be about 0.3 centimeter for upper area, and then lower back about 0.8 centimeter, or this much, maybe 0.7 centimeter, maybe one third quarter inch. But if you have a bad posture and bad ergonomics, you're gonna sit like this. The neck, spine, this person already lost half of the disc, becoming more arthritic issues and more bony spur later will be fused as time goes by. So she has a lot of arthritis, especially lower area. So the bottom of the spine already lost maybe 70% of this. That means more arthritic changes later, 10 more years, and fuse. Then it will show reduced range of motion, less flexibility, less strength. And the other one, it's already reverse curve with a bad posture. Also reduced disc space and the height of vertebra, as you see there. Supposed to be this much, but losing. Disc space plus vertebral size of the vertebra. We can go next one. Oh yeah. I think the tablets.
The tablets are better than a liquid?
I don't know about that exactly, but usually I take tablets. It shows the same thing, disc space reduced and reverse curve. Can you go to the next one? This is one of my patient. Because she has a car accident, and then I took X-ray. And another person here with a compression fracture with a fall. You see here, it's just collapsed. Yeah. So any fall can cause this one. So make sure no falling, no. Yeah. Can we go to next one? Here, this one shows lower back with a trauma or bad posture can cause this. This reduce this space and bony spur, and the ligament become bone. You look at the right side, it's all supposed to be ligament, but the X-ray shows calcification of the ligament, and later will be fused. Right X-ray. Can we go to this one? Yeah, DJD. I already show you the bony spur, swelling, tenderness, loss of flexibility, weakness, less movement. That's the DJD. So, can you go to the next one? This one. The let me see. 1500, when Mr. Columbus came to America, He was in the ship all the time, so he used to have a lot of arthritis. Yeah, that's if you look at here, two king in Spain, they smiling. The other two kings, they didn't like the cruise to the America. That's why two kings making face, the other one smiling. That's in where is that? The one of the Spain, the cathedral church in, I think it's Ceboya. Yeah, I was there one time. Can we go to? Oh, also, I don't know. You noticed this? 1500, year 1500, when Spanish people came, every year, 40,000 people died when they came because of the human sacrifice with the sun god and other god. But as soon as they came, they built a lot of churches and no more sacrificing. But still, these days, another 40,000 people dying in Mexico because of the cartel and drug. So same numbers, but different reasons. Okay, can we? Because I go to Mexico a lot because a lot of my patients they speak Spanish, so I go to Mexico to learn the language and culture thing. So I just want to show you. So can you go to next one? Next one. Yeah, can you go? So for DJD treatment, make sure good fish and fruits, veggie, and exercise, some physical therapy session, and ice heat all help. All help the DJD development. Oh, stress? Oh, you mean repair stress injury or just, oh,
How does it cause it?
because if you keep using same movement, you're gonna use the same bone, same muscle, because the ligament and muscle attach to the same bone. If you keep using it, it causes more tension and causing more the damage to that joint, specifically that joint. Because if you keep doing this, you're gonna use the same muscle, all the muscle insert in same bone, specific point of bone. So if you keep repeating, it's gonna damage that point. Same soft tissue, same bone. And then extra bony spur and arterial changes with the same stress. So make sure you need to move around, change the repetitive stress using other side or different motion. We don't want
Keep all the other muscle groups in the area active. All the other muscle groups, you keep them active, so it's not just that one.
right, yeah, use different motion, right? Not same, because if you keep doing this, you're gonna damage the soft tissue, and later the muscle tear. You have to have surgery if you keep using it. So we need to do some other motion to protect or prevent from further damaging. Yeah. Okay, can we go to other one? Yeah. Yeah, I already showed you. The disc has a moisture, maybe 70%, 30% muscle fiber inside the disc. and also proteoglycan, the substance connecting all the soft tissue. But with that pressure, the reversed curve can cause the damage. It comes out, and then sometimes goes in. Sometimes you have to have surgery, but don't do surgery right away. You have to wait. Good management. Yeah. Can you go to the next one? Next one. Oh, this one. Yeah. Sometimes I go to Korean community to this thing, so it's a Korean language. Yeah. So make sure to prevent this injury, proper bending, twist. Yeah, don't do bending and twist same time. And body weight evenly. And use posture-friendly chair with an angle cushion, so the weight goes toward your lower extremity instead of it gets stuck here. So when you do this, everything's stuck here. When you do this, it goes down. Okay, can we go next one? Next one is called spondylolisthesis or antherolisthesis, means it goes forward. One of the vertebral spine, it goes forward with not evenly distributed pressure. It can cause this one. And then later, it's worst case, the surgeon, they put screw, and then that's not the end of the surgery, but later more issues in other area, because if you don't move, it can cause more arthritis other area. So other consequences. Can we go to the next one? Facet joint syndrome. This two joint is called facet syndrome. Can cause the spinal stenosis. More bony structure accumulate inside the canal. It can narrow, push the spinal nerve, and it has to call facet syndrome. Can we go to the next one? I show you already the yellow ligament become calcification. It's called ligamentum flavum issue. So diabetes, obesity, stress, blood pressure, and bad posture can cause that one. Behind this spinal cord, there is the spinal canal. This canal become narrow with that yellow soft tissue calcification. But that one we don't know until they examine inside with the camera. So that one will be done by a surgeon. Next one. Yeah, that yellow ligament become calcified bone with diabetes, overweight, and less activities, and arteritic change and stress. Can you go to the next one? Okay, yeah. Next one. Okay, this one is important because if you keep using same range of motion or same movement, this extensors, all the how to say, this motion of our bone, we call it extension. They all from Latin period. Extendere means you do this motion, and when you do flexion, all the flexors muscle attached here. And if you look at your hand with all this soft tissue, it's extensors, because this function of this muscle is extend. But if you keep using, the damage will be done on the insertion of the inserted area. So all goes here. So tennis all the time can damage this area. Golf or other tennis activity can cause here. So in order for you to prevent damage, you put tennis elbow, blocking all the damage toward your elbow or wristband. So blocking, because you cannot do this all the time. People with the typing all the time can cause damage here, because everything attached here. That's extensors. So extensors, flexors, so repetitive motion will damage the insertion area. Here.
Is collagen, like plant-based collagen, is that, can you use that for an extensor?
Oh yeah.
And
yeah.
what kind of plant-based collagen is there? Like, cause like beef, or they say to use beef or
Yeah,
animal
beef. Yeah, the
collagen.
protein, meat. Yeah.
What kind of plant-based collagen is it? You know?
Oh, I'm not that I'm not specialized in that nutrition area, so maybe talk to your yeah, nutritionist. Okay. Oh, can you go to next slide? Okay, I show you already. There's a path, repetitive stepping, walking with a hard surface can cause the injury and inflammation on that spot. So make sure when you do a lot of hiking, walking, use the cold bottle massage, golf ball, or other massage for your bottom of your feet. We cannot keep using this one, or walking. Same muscle repetitive stress can cause all soft tissue injuries. So repetition is the worst. Sometimes change the positioning, take a break, do other activities with a different motion. Can we go to the next one? Yes.
So, I mean, like, if I go to the gym, I'm on a treadmill 30 minutes.
That should be okay with the soft shoes.
Oh,
Yeah. But you need a break at least 48 hours if you use the same muscle. Always at least 2 days a break, because you cannot keep using it. Yeah. Need time to build up and rest.
So you could do cardio.
Yeah.
One day,
Yeah. And then you can reverse it. Yeah. Okay, sir. Next one. It's the same thing. Can we go next one? Next one. Next one. Oh, if you do too much pressure, same repetition, there's some people have a spur in the calcaneus bone in the bottom of your feet. So you need a soft one and not too much hard surface to prevent this. It's called heel spur. You see the heel? Yeah. Can you go next one? Oh yeah, rotator cuff. Yeah, as I showed you earlier, there is a spinous process. The top muscle group is called supraspinatus, controlling lifting. So people with a lot of lifting this way for their work, they want to damage the tendon there on the top. If they have too much rotation with their work, they want to damage the bottom of the muscle group. Right there, if you see the ligament the white portion, and the bottom one is called infraspinalis and teres minor. So that's the power of the rotator cuff muscle. So 2 on the bottom, you do too much, this motion, or this motion can cause that straining of the muscle. Oh, this motion? Yeah, yeah, so be careful. Can you do next one? Can you go next? Oh, it's very important. Another very important issue here, which most people, they don't pay attention because the society don't tell you the secrets. Whiplash injury, I took care of about 15,000 people with a whiplash injury, car accident, 15,000 cases. 1 out of 8 has no insurance here. No insurance, no car insurance insured. So make sure your car have, it's called UM. UM covers everything. Yes. There is a liability benefit plus a property. So make sure you have 2 UM. 1 out of 8 in California, but in Oakland, maybe 1 out of 6, no insurance. So I see a lot of patients later, they happen to have less benefits. That's the, yeah, uninsured motorist. Yeah, maybe church member might do the insurance thing. Yeah, and that's the insurance part. Make sure you have the headrest above your head, because when there's impact, it goes like this. But if you don't have a rest here, it goes like this, more hyperextension. So make sure you have a headrest covering your head height, maybe at least 2 or 3 more inches. The headrest should be higher. Yeah. And also, oh, I forgot, the camera. Inside your car, you should have a camera. Yeah, it's about $30 from Amazon. You could just there and record 30 days. Because most people, not here, but some people outside, when they come to other lane, a lot of people say, I didn't do it. And then no witness, then automatically you have 1 point in your record. Then it goes up. So camera.
But you have a camera on your phone.
No, it cannot record while you're driving. Yeah, car camera, Amazon. Dash cam. So a lot of people regret that they didn't have anything. So that's just for your protection. I took care of about 15,000 people with accidents. And yeah, dash cam, yeah, and make sure you have a back support in your back. I use that angle cushion for my back while I'm driving. Head rest up. That's about whiplash. Did I cover everything for this issue? Oh, that one. So most time with a whiplash, sports injury, damage the SCM. This muscle here, SCM. SCM, why is SCM called? Because sternomastoid and sternum, they connecting two area here. That's called SCM. But damage here, SCM, and some other muscle here in the back. So the hyperextension, flexion always damage all this muscle here. Yeah. Is there any other slide? Oh, I think there is some other. I use all the medical terminology or the picture from this medical books. Yeah, some students, before they go to medical school, they have to study this. Oh, this one here, there are other core muscle for your back, front and back. That's one of them is psoas muscle, starting from L1 through your hip joint. It goes inside of your hip. It goes like this. And that one, you need to strengthen and stretch all the time. So strengthening, you do resistance for this knee. For stretching, you can do this. Stretch. Here. Yeah. Here. This is stretch. Psoas muscle. That's the anterior muscle for the core muscle in the back. Yes. Yeah, you have to use it. If you don't do any resistance without doing anything, you're gonna get your muscle get weakened. Yeah, you have to be more active. Yeah. Yeah. That's a psoas muscle, and there are another muscle group for your back core muscle. Can we go to next slide? Oh, this is one of the core muscle in the back, upper body. One of them, deltoid trap and latissimus dorsi. So if you go to your gym, do a lot of this one here and this, that's strengthening the your core muscle in the back, upper area. And can you go to next one? I want to show you. Okay, the erect means stand in Latin, 2,000 years ago. So erector muscle for 3 muscle group. Let's see, where is this one? If you look at here, it connects all the spinous process. That's called spinalis. That's one of the core muscle for your back. The next one, here, this is called transverse process or your spine, all connecting. This is the green one, connecting, side. Not the center, but this one. Yeah, this is called yeah. Okay, and then how about other one? Oh yeah, right there, right there. Next one. Okay. The second one, this is called longissimus muscle. Longissimus is longer. Yeah, longissimus, Latin too. And then third one, from ilium and iliocostalis muscle. That means connecting from ilium to the back of your rib cage. So those 3 muscles, very important to support your back this way. So it's called erectors spinalis. So those 3 muscles are very important. So when you go to gym, do the back strengthening exercise. So core muscle here, and psoas, and trap, latissimus dorsi, and those 3 muscles, very important to support your back injuries. Can we go to the next one? So to strengthen the core muscle for the back, front, you can do this plank exercise about 20 seconds, 30 seconds. Have you ever done this? Okay, and the next one is called bridge. You just lift your hip. Yeah, you've seen this, yeah? Bridge. Also, you can do next one, bridge with an extension. Extended leg. Yeah, you can change. That's another strengthening exercise for your core muscle in the back. And also front. Can you go to next one? This sheet shows the basic low back exercise, stretching and strengthening exercise for lower back. Some of them covered in our slide. Some of them you can look at. Do a lot of stretching for, this groin area, a lot of stretching. And also quadricep stretching. And then hamstring. And then core muscle for the neck all the times. So when you get up in the morning, make sure start from top to bottom to prevent arthritis and other issue. Do a lot of range of motion, neck, shoulder, and then rib, waist, knee, and then ankle. So top to bottom, you can practice every day. Yeah, morning and then evening time to prevent arthritis from top to bottom. Yeah, that's the exercise. And any other slide here? That's it? Okay. So this class, this seminar shows all the not all the stuff, but some anatomy, some nerve structures, muscle structure, and strengthening, stretching, exercise, and how to properly sit up straight, stand, those areas. And I can finish this seminar with a couple more questions. Any question? Yes.
Doing your exercise regimen, would you suggest you do a combination of cardio, walking, and stretching? I'm just saying, instead of just doing the same thing the same days.
With the cardio and just general stretching, you can do the same time, but strengthening, you need at least 2 days break.
Okay.
Because you cannot keep strengthening your muscle.
Okay.
So cardio is okay all the time,
Okay.
but the strengthening, you need at least 48 hours.
Okay.
Yeah.
All right. Thank you.
Okay, anybody else? Okay, here you go.
Oh, okay, one in the back. So what can you do about the fatty buildup on the back of the neck? I know for me, that started happening as I got into college, and it's unreal how fast it happened. It's just like a round thing on the back of your neck.
Which area?
Back here.
Okay, maybe I can go over with you.
Oh no.
Okay. Let's see where it is.
Oh, I see.
But I just want to know what I could do.
Okay, I see. So can you do one more? Can you do one more? From there? Yes, sir. Yeah, for my the office. Yeah. Okay, ma'am. Yeah, that one you need to check with the medical doctor. You have an extra Yeah, you have
Yeah.
extra fatty tissue there.
Okay.
Yeah, that's not. It's not gonna go away.
Okay. Is that what? Can I exercise? I can't exercise.
Okay, yeah, I see. Um, if you look at my bone here, uh, everyone has a extra longer structure of your C-spine. C-spine, and your case have extra fatty tissue here. So if it, but still you can check with your medical doctor. They can do something.
Oh, I was doing spot exercises,
I think so.
but it just keeps getting worse.
Okay, and you had a question too. Okay. Well, just check with them and see what they can do. 'Cause
So
Well,
everybody has extra
there
bone.
might be other things.
Not extra bone, extra fatty tissue. Some no, some people, but also here
Right there.
the seventh cervical bone in your lower cervical spine has a extra bone or longer bone. That's why when you touch it, you feel the bone is part here. So that's normal, but some people has a fatty tissue here extra. So maybe the cosmetic doctor or MD, they can do something. Yeah, but if it doesn't bother, I see.
God, leave it alone, right.
Okay. All right. So,
Okay, I do have one more
Any
question.
question?
I have one more question back
Yes.
here.
Yes, sir.
So real quick. So,
Oh, so yes. 1 second. Yes.
yeah, so real quick. So like I'm a member of a gym and I do a lot of classes. But what I'm finding, because I'm really interested in burning fat and building, so I know that doing classes is not going to do that. And so hiring, I guess, a trainer to, because I tried doing the weightlifting on my own and I don't know what the heck I'm doing. So what can you suggest for an aging adult to go into the gym and start to, because I also...
Yeah, if you go to a gym, there is a trainer. They can do...
They're expensive.
You can have a separate area of your body, like upper body separately, or lower body, the major muscle group, like pec, the rotator cuff muscle, and core muscle for your upper back, neck, and then the lower. There are maybe 10, 15 major ones first. They will show you.
Okay,
Yeah.
thank you.
And I have a book, I'll bring it next week, on strength training for older lady that deals with things you can do at home. And you use light weights, 5 and 10 pounds, things like that. And then most gyms will show you how to use the equipment. They don't charge you a trainer, but they show you how to use the equipment in the gym properly.
Yeah, you
So take advantage of that.
Strengthen your muscle. They will show you.
Yeah.
Yeah.
Okay. One more question?
Just in general, what do you prescribe as far as, do you prescribe exercise every day? And is that in the morning? And about how long?
For stretching exercise,
Yes.
I like morning better. Stretch,
Morning?
and then evening time another stretch. But the strengthening after stretching first, and then strengthening.
Okay, and if someone thinks that they have bone on bone,
Yes, first, and then strengthening.
limbs, should they lay off, not mess with those, or
What's
what?
that?
If you perhaps someone told you that you have bone on bone, as far as your ligaments are gone, you should not work with those, or what? Yeah, no cartilage.
You mean ligament?
Yeah, well, your ligaments are gone, but and your yeah. Between bone. You mean the lumbar spine? That or knee or
Okay.
something like. Should you suggest going to get some kind of replacement, or? Well, I guess that's too individual. So the exercise part of it was good enough.
For strengthening and less damage to your for your knee.
Yes.
No quick movement. No quick movement like a golf. No quick movement. Also, if you strengthen the leg muscle connecting the knee, like here it's called ITB, iliotibial band, right here, with the ankle weight. You can, from lying position, you can do this, like 2 pounds. Also, this one, if you build up this muscle here, you have a less
Takes the pressure
stress
off the
to your
knee.
knee joint. So these are very common exercise to prevent any damage to your knee or also protect. So do this from lying down, do this, and face down, this, sideways, but you need at least 2 pounds of sand. You can order through Amazon, maybe $10. Yeah, so those the exercise, strengthen the ITB band. Also, right here, this muscle here, it's called adductor. This one, from lying down with a weight. This one, lying down, this one. Yeah. This is this is adductor, abductor. Strengthen both to protect and prevent further damage. That's the best one for knee. No problem, sir.
Okay, I think we've about run out of time today. Dr. Lee, we really appreciate what
Thank
you
you for
brought to us today. And maybe later in the year, we're going to have you back and do it again.
Sure. If any one of your friend or other family member with any other church who needs this, I can be available in the future. So please let me know.
All right, thank you so much. And for those online, thank you for hanging with us this evening. And we will be sending you out the handouts after the program tonight. So thank you for attending, everybody.